Assalamu alaikum. My name is Varda Dost and my roll number is BP 1650-249 from group number 21. And today I will be presenting on the topic atrioventricular block, also called as AV block. So first of all, what is AV block? Atrioventricular block is a type of heart block that occurs when the electrical signal traveling from the atria or the upper chamber of the heart to ventricles is impaired. Normally, the sinoatrial node produces an electrical signal to control the heart rate. So, AV block is partial or complete interruption of impulse transmission from the atria to the ventricles. Now we will be discussing the causes of AV block. So the first of all, the most common cause of AV block include fibrosis or sclerosis. It happens when extra tissue can thicken, scar, and damage the pathways that send signals from the upper part to the lower part of your heart. The second important cause of AV block is coronary artery disease. This damages your heart's blood vessels, so it may cause AV block before or after a heart attack. There are also some other factors that contribute to AV block. These are certain medications. Certain drugs can slow your heartbeat. This includes blood pressure medicine like beta blockers and calcium channel blockers. Apart from this, increased vagal tone. This happens when you have more activity in a nerve called the vagus nerve. It's a problem that sometimes shows up if you are physically fit. Birth defect or genetic disorder, you can also inherit certain heart conditions that lead to heart block. Illness. Some diseases and infections can hurt your heart, like rheumatic fever, sarcoidosis, lupus, and Lyme diseases. And electrolyte imbalance can also lead to heart AV block. Your heart may not beat normally if you don't have the right amount of minerals in your blood. AV block may happen if you have too much potassium. And last, heart surgery. Your electrical system may also get damaged during the process. So these are some causes of the AV block. Now we will be discussing types of AV block. There are commonly three types of AV block: first degree, second degree, and third degree AV block. So first of all, I would like to elaborate first degree. In first degree AV block, normally there is a delay in the electrical signals. Our heartbeat won't get blocked, but it may slow down. This kind of AV block is more common in athletes and young people. The second degree block is additionally divided into Mobitz type 1 and type 2 AV block. Type 1 is also known as Wenkebach. In second degree type of AV block, our electrical signals won't make it through. As a result, we will have a drop beat. That means our heart rhythm may be slow or irregular. And the third degree type of AV block is the most severe type of AV block. In this type of AV block, no electrical pulses will get through, which is why it's sometimes called as complete heart block. And that is why it is more serious than first degree and second degree type of AV block. So, other parts of our hearts, like AV node or ventricles, will have to create their own current, but these signals are less reliable. So, our heart may only beat 30 to 50 beats per minute. So, now we will be discussing symptoms and diagnostics. So, how we will be, so first of all, we will be discussing the symptoms of AV block. Usually, the first degree type of AV block is less serious. And normally it is asymptomatic. That is why you may not notice any signs or symptoms. But with second degree, you may have little side effects such as you can get tired, feel dizzy, or fainted. You can have a slow heart rate, and your heart beats can skip. And normally there is a chest pain. And when we proceed to third degree AV block, the symptoms get more serious, like extreme fatigue, irregular heartbeat, or sometimes no heartbeat, which can result in cardiac arrest. Now, how can we diagnose AV block? Normally, our doctor may prescribe ECG, which is also called as EKG. Um, what does ECG does? It puts the rate, rhythm, and electrical timing of your heart on a graph, and each type of AV block has its own electrical pattern. Your doctor may also prescribe Holter or event monitor. These are portable ECGs that can check your heart signals for a longer period of time. You will wear a Holter for a day or two or an event monitor for a month or so. Apart from these, we have implantable loop recorder. You can wear this for up to 2 years. Your doctor may give you one if your symptoms don't happen often. And last, electrophysiology study. A surgeon puts a thin bendable wire, or we can say catheter, on top of your heart. They usually do this at hospitals. So usually we use these methods for the diagnostic purpose of AV block, but most commonly used is ECG. So now we have a case study. A 63-year-old man was admitted to the coronary care unit 12 hours ago with an acute inferior wall. He has remained stable. 12 hours later, the rhythm shifted to Vankebach or type 1 second degree AV block. Are these rhythms potentially hazard? How is the second degree AV block different from first or third degree AV block? So I have prepared some soap notes. Let's get through. First of all, let's look at our subjective uh, age. We have a 63-year-old male. History of illness. He has a history of acute inferior wall. Chief complaint not mentioned. Medication history and current medication are not mentioned. Let's proceed to our objective. Vital signs and lab reports are not mentioned. When we have performed ECG, um, it shows AV block. Let's move to our assessment and plan. So in assessment, we can see as here in the ECG, it shows that the PR interval is prolonged. So um, what we can say from this ECG is that normally in second degree AV block, as we can see, the PR interval progressively prolongs until after the third complex, a QRS is not conducted. So prolonged PR interval is the indicative of type 1 second degree AV block. So now what will be our plan? Second degree AV block in the asymptomatic patient does not require any specific therapy in the pre-hospital setting. Normally, in first degree AV block and second degree AV block, if you are asymptomatic, you does not require any specific therapy or any because it is not a more serious condition. So it does not require any specific therapy. But in symptomatic patients, normally a cardiac life support is given, and also the use of atropine is also indicated. Also, your doctor may give you an artificial pacemaker. That's a device that sends an electrical current to keep your heart pumping. Uh, that moves us to our last slide, that is extra notes. So what we have to be careful in AV block is normally some drugs also induces AV block, and that includes beta blocker, calcium channel blockers, antiarrhythmics, and digoxin, as we have already mentioned in the causes of AV block. So we have to be careful in administration of these drugs in a patient um, who is already facing AV block. So withdrawal of the offending drug is the first treatment of heart block. Also, permanent pacing is the therapy of choice in patients with symptomatic atrioventricular block with bradycardia. So normally pacemakers are given, and In first degree patients and second degree asymptomatic patients, no specific therapy is required. But in third degree, we may have to give a artificial pacemaker to keep the heart pumping. Thank you so much. Thank you.